Hi, my name is Luciano Costa. I'm a professor of medicine at the University of Alabama at Birmingham, O'Neill Comprehensive Cancer Center. And I want to discuss two posters that I presented this year at ASCO. One poster, they're both related to CAR T-cell therapy in multiple myeloma. Well, the first poster is related to the use of Anakinra to prevent cytokine release syndrome. So this is a subset of the study called EVOLVE, that study the CAR T cell called Orva-cel, which is also a BCMA binding CAR T cell therapy. And as we all know, cytokine release syndrome, the fever, the problems with oxygenation, changes in blood pressure, is the signature side effect that can occur with CAR T cell. And in some cases, maybe less than 10% of patients in general, that can become quite serious. The patients even need intensive care unit care. So it's of great interest to try to reduce the risk and the intensity of CRS. And CRS has several mediators. The cornerstone of the management is a blocking of the interleukin-6. But what we did in this study was to explore the blockage of interleukin-1 with a drug called Anakinra to prevent cytokine release syndrome. So in this subset of the EVOLVE study, we did Anakinra prophylaxis the day before and the day off of the administration of Orva-cel to 14 patients. And we did a comparison with patients who received the same treatment without Anakinra prophylaxis. And what we saw was a reduction in the rate of grade 2 cytokine release syndrome, which is essentially fever and drop in blood pressure or fever and low oxygenation, that really reduced from 53% to 29%. And the risk of grade 1 went from 37 to 64%. So essentially, you change more patients from would-be grade 2 to grade 1, which is just a fever. Of course, this study is small. It's exploratory, but it can really gives a signal that Anakinra might be utilized in the future to prevent and to manage cytokine release syndrome. Very importantly, that improvement on the side effects did not seem to be followed by any problem with expanding the CAR T cells and the CAR Ts being active, since the rate of response was very similar between the two groups.